Dulcie Wanda. I am a clinical oncologist. That means a doctor who treats cancer using chemotherapy and radiotherapy. Today, we'll discuss about lung cancer. So, a human has two lungs, one on each side of the chest. And the function of the lung is respiration, where you breathe in oxygen and breathe out carbon dioxide. The lungs are very supple and able to breathe in, expand when you're breathing in, and contract when you're breathing out. Sadly, the lung can develop a tumor, a growth within the cells in the lung, and that growth can be a cancerous growth. What are some of the symptoms of lung cancer? One, a new cough that doesn't go away. So you have this cough that is always present. You might have some chest pain, you might have coughing. The coughing can be just continuous, or you might cough up blood, even if it's a small amount. Hoarseness of your voice, a change in the voice, and shortness of breath, and wheezing. By shortness of breath, I mean you feel like you're out of air. Walking short distances, you feel you're breathless. When the disease has been there for a while, you might notice you have some bone pain. You may have a headache if the disease has gone to the brain. You may lose weight. You may have loss of appetite. You might have swelling of the face or the neck. On raising your hands, you might have flushing of the face. Those are some of the symptoms. For others, there are no symptoms. Perhaps the only thing they notice is a clot in the leg, which is called deep venous thrombosis. So, if you have a clot in the lower limb, which is called the deep venous thrombosis, how would you know? You would notice that one limb is swollen, shiny, and warm compared to the other leg. And that could be a sign that you have a clot. Whenever we notice that, we look out for risk factors that could cause that. Maybe you've had a fracture, you've sat down for too long, or it could be the first indication that you have cancer, such as lung cancer. What causes lung cancer? So every cell has DNA within it, which is genetic material that tells it how to grow, when to divide, when to stay in one position. So that DNA that controls the cell can be changed, can become abnormal, such that it makes a group of abnormal cells, which we now call a tumor. And that is what cancer is all about, and that can happen in the lung. So some of the risk factors that have been known to be causing that is cigarette smoking. Cigarette smoking has components within it that are irritating and are cancer-causing, called carcinogens. They cause cancer. So when you smoke cigarette, you inhale those particles, and they go into the lung, and they change the genetic material of the lung, making it cancerous, making it a group of abnormal cells. Other risk factors other than smoking is exposure to secondhand smoke. So for example, if I am smoking and you're seated next to me, you are also smoking. And actually, mine is going through a filter, and yours, there is no filtration. So if you have friends, if you have a spouse who smokes around you, you are at risk of getting cancer of the lung. If you've had radiotherapy, maybe to the breast or to the sternum or to the mediastinum as treatment, either for cancer of the breast or other cancers within the area where the lung is, it's a risk factor to getting cancer of the lung. If you've been exposed to a gas called radon, then that's also a risk factor. Radon is a gas that has been found, I think, mostly in the West, and found when you go to basements or underground. So exposure to radon is a risk factor. Then, if you have a family history of lung cancer, like my mother had lung cancer, my sister has lung cancer, then that means I am at risk of getting lung cancer because some of the material could be genetically passed on to me. So how do we make a diagnosis of lung cancer? So first, we need to know their history. So if you're a smoker, we recommend that every smoker has what is called a low dose CT scan. That's an image every year. We know the risks of getting lung cancer are very high among the smokers, and we want to keep screening them to ensure that we catch it very early, at the earliest opportunity, because the earlier we catch it, the easier it is to treat. So once we've done imaging and we've seen the lesion, then it is important for us to remove a biopsy, a small piece of that tissue, abnormal growth, so that we know what type is it. Because there are types of lung cancer. We have the small cell and the non-small cell, and the treatments are different, and even the patterns of spread are different. So for us to know how to treat it effectively, we need to know which type are you having, so that we know the treatment that we can give you. Once we've confirmed, the treatment, if it's a small lesion, can involve surgery. Maybe just a lobe is removed of the lung, or an area where the tumor is, or sometimes even the whole lung can be removed. You can survive with one lung and live a perfectly normal life. So surgery can be an option. There are times where surgery is not possible. We give chemotherapy drugs and even radiotherapy. There are targetable agents that are now present that reduce the side effect profile and have shown remarkable improvements in terms of outcome. Sadly, lung cancer has a high mortality. One, they present very late, and also the disease itself is quite aggressive. So what is my message? If you're a smoker, kindly stop smoking. If you stop smoking today, you reduce your risk of getting lung cancer for every day that you do not smoke. Meaning there is a benefit of stopping now. There is also a benefit of going for screening. Meaning, go for the low-dose CT scan yearly if you're a smoker or at-risk population. If you have made the decision to stop smoking, one, you will need to change your lifestyle. You'll need to change your friends, your entertainment places you go to visit, and you will need to replace the addictive component that is in the cigarette, which is the nicotine. It can be in the form of nicotine patch. It can be in the form of chewing gum that have nicotine, just to reduce the craving that you have for smoking. There is help to quit smoking. So lung cancer is present. It is the number one killer in terms of all the cancers in the world. You can do something about it to reduce your risks, and you can get screened for it. And if we catch it early, it is very possible to have good outcomes. So my message, if you're a smoker, please stop. If you've been smoking for a while, get screened, get the CT scan done. And if we notice a lesion, kindly go to hospital early so that we can get it, treat it, and you can live disease-free. Thank you very much for watching. I'll see you in the next video.